Joe Harris. I'm the director of the Global Health Politics Workshop, and I'm very pleased to welcome you to our 8th session and final session of the workshop for this year. We will have more sessions next year, so please look forward to that. It's going to be an exciting lineup, just as it was this year. I'm extremely pleased to have our final session here with Emily Mendenhall, who is the author of 4 fantastic books, including her latest, Unmasked. If you don't have a copy, please do go out and get a copy. She'll be talking about that today. It's Unmasked COVID, Community, and the Case of Okoboji. She has worked on a number of different issues in her life, ranging from HIV/AIDS to mental health and trauma to diabetes and syndemics. So she is now a professor and medical anthropologist at the Edmund A. Walsh School of Foreign Service at Georgetown University, and will be giving this talk today on her award-winning book, Unmasked. Emily.
Thank you. This is truly a privilege to join you all today at the Party School of Global Studies and the Global Health Politics Workshop. And thank you, Joe, for the invitation. I've had such a great time getting to know you better and learning about all the wonderful work all of you are doing here. So thanks a lot for inviting me to this. You know, more than 3 years after those first days of the COVID pandemic, when we left our desks, offices, schools, stores, and public lives to hunker down for many months, we are still pulling back the layers to understand America's massive divisions and how we think, act, and engage in and around this virus. I am a medical anthropologist who is also trained in global public health. Most of my work over the past 2 decades has focused on understanding what people struggle with and where, public health, and why and how people struggle with illnesses differently in one place compared to another, anthropology. Although most of my research has been conducted far from home, the COVID-19 pandemic brought a convergence of my personal and professional life in a way I could not have imagined. Like many of you, my life's work got real when COVID-19 changed my life, your life, and the world. When everything shut down in March of 2020, I was living in the Washington, D.C. area with my husband and my 2 young children. As many of you remember, the change from this world to that world in quarantine was drastic. Although at first a fun experiment, slowly people realized that our lives might be upside down for a while, and of course they were. After the first 3 months in quarantine, I packed up my family and drove west to my hometown in Northwest Iowa called Okoboji to escape the swampy DC summer and to be with my family. The drive west was eye-opening. We drove through Maryland, Pennsylvania, and Ohio. We stopped near the Indiana border where we noticed fewer people were wearing masks while filling up our car. As we continued west, we saw even fewer masks. And in some gas stations, you would never know we were in the middle of a pandemic. When my 6-year-old had to get her wiggles out, we pulled into a gas station surrounded by cornfields and did cartwheels for 15 minutes. My husband, Adam, went and filled the car with gas. When he came out of the gas station, he had beef jerky and a smirk. They asked me where I was going, and I told them Okoboji, and they were like, "You going to the party there, bro?" Adam laughed and shook his head. I told them I wasn't planning on it. Nobody was wearing masks. We found the Wild West. When I picked up groceries the next morning, nearly everyone was unmasked, but this shouldn't have been too surprising. Iowa was one of a handful of states that did not enact a stay-at-home order. Iowa was the last state to act when Republican Governor Kim Reynolds closed schools, churches, restaurants, and many retailers for a few weeks. With no lockdowns, many non-essential offices stayed open the whole pandemic. From March to early May in 2020, there were only 6 cases in Dickinson County. As May approached, people started itching to get back to normal, especially when the sun came out and the lake warmed up. Those who know me well have heard of Lake Okoboji. I have evangelized for these waters all over the world, dropping towels and cups and t-shirts for my mentors, my friends, my colleagues. In part, this is because Okoboji is a fun tourist town, and it's a fun word to say. In fact, nearly 50 years ago, a friend of my dad's created the fictitious University of Okoboji The university was fake, but the founders used the ruse to sell the Iowa Great Lakes throughout the Midwest, attracting an increasing number of tourists and summer residents to the lake. The University of Okoboji is, in fact, probably the greatest myth in advertising the community has ever seen. Okoboji is the perfect example of a community that diverged to the political right early on in the pandemic. It is not surprising, as 2 in 3 people in the county voted for Donald Trump in the 2020 election. In many ways, Okoboji and the surrounding area reflects other American communities' responses to the pandemics, who were primarily Republican, white, and Christian. In the United States, the federal government provided relatively weak pandemic policies, transferring leadership to states and in many cases to the counties. Trump relegated power to implement public health measures to the states early on in the pandemic and created confusion, fear, and stress among people across red and blue states alike. Drew Altman argued in the BMJ that delegating primary responsibility to the states in a crisis resulted in the states and the American people split strikingly along partisan lines in the response to COVID-19, as if in the country both has blue and red pandemics. Now, within weeks of the virus in America, performative politics by then President Donald Trump exacerbated these chasms by refusing to admit COVID-19 was a risk in order to protect the economy. Despite the human cost of Trump's denialism, his leadership style profoundly shaped what Americans chose to believe and do to protect others throughout the pandemic. Iowa's Governor Kim Reynolds consistently parroted these conservative politics over the course of the pandemic. And similarly, State Representative John Wills, a long-time Okoboji resident and Speaker pro tempore of Iowa's Congress, wrote an op-ed in the local paper at the end of April in 2020, arguing that it was time to reopen the economy. He wrote, "We can fight COVID-19 by adding public health precautions to protect ourselves and others, but also get people back to work and have Iowa thriving again." Now, this was in part because of the anti-government sentiments that are common around Okoboji. Such individualism is actually even inscribed here. You can see on Iowa's flag, "Our liberties we prize and our rights we will maintain." But it's as cultural as it is political. Economists have called the strong anti-government sentiments in the American Midwest a total frontier experience that reveals a primacy of personal goals over group goals and the regulation of behavior by personal attitudes rather than social norms. Midwestern historian Kristen Hoganson describes agrarian markets as bound into the us versus them mentality, a desire to dominate in a win or lose world. Statements like, "I don't need the government, I don't want the government to interfere in my life, and I don't trust the government," were ubiquitous in the Iowa Great Lakes and explain in part why Republican Governor Kim Reynolds' inactions to intervene in public health during the COVID-19 pandemic were so longstanding. Now, in what follows, I use the case study of Okoboji to demonstrate what happens when national, state, and local leadership fails in leading a coordinated public health response in a time of crisis. Iowa never enacted the stay-at-home order, and many people's everyday lives were not drastically altered by the pandemic at all. There was a strong local resistance to public health prevention when the summer tourist season began, because the summer tourist season was a primary source of annual income for most residents, many in fact. By May, a number of restaurants, bars, marinas, golf clubs, and other summer activities opened up, and few were enforcing any public health protocols directed by state or local authorities. Now, I arrived in Okoboji with my family on June 6th of 2020. It's important to point out that we arrived in the middle of an outbreak. Although there were only 8 cases by Memorial Day, a week later, cases shot up by 50. My brother-in-law, who you see here, Dr. Zachary Boris, worked tirelessly to figure out what caused the outbreak, how many people were infected, and where. You see, my brother-in-law was leading the public health effort. He had moved back to Okoboji with my sister a few years before and worked in both family practice and public health. Most of his work from March through June had focused on education, testing, and contact tracing. Now that cases shot up, the public health community scrambled to get a hold of it. I scrambled to do my part too. I threw together a project and dove into interviewing people in the community about what caused the outbreak, where cases were concentrated, and how to stop it. I started interviewing people one by one. I reached out on Facebook, text, email, and on the street to everyone I knew. Over the course of the summer, I became fascinated by what I found. People were thinking about COVID-19 in such drastically different ways than people on the East Coast, and even many of my friends and colleagues from around the world. I spoke to hundreds of people informally and about 100 formally. I attended public working group meetings of the school board and wrote observations on about everyday life on scratch paper and napkins, especially when my kids would confiscate my phone. I quickly realized that the wealthy business owners in the community had a lot more power than public health officials, in part because of their informal networks, not only with the local county supervisors, but also with state leadership, including the governor. The only power Zach had really was in educating the public. In many ways, this was a powerful tool. Many people said they trusted Zach when they didn't think they could trust any leaders at the national or state level to tell them the truth or put their needs first. They thought Zach had their best interests at heart. Regardless, after Memorial Day, people stopped masking and businesses slowly dropped enforcing public health recommendations. This was in part because the local community depended on the summer tourist economy to survive, and many people make enough money during the summer to last the whole year. A summer without income threatened the family's livelihoods. But for some business owners, especially those with lots of money and power, it was more about profit margins and less about families or individuals. Like most things, I realized that there's a lot of complexity at play, that things were not black and white, that beliefs are not linear, and that people were not all the same. And not everything was political, but a lot of it was. Now, for instance, let me read you an excerpt from my book about Jay. I spoke to a local metal worker who described himself as a libertarian and avid fan of the political podcaster Joe Rogan. Jay described how important the Facebook videos of Zach, my brother-in-law, had been for him, in part because he was frustrated by the inconsistent messages conveyed by the national and state leadership. Jay was, however, reassured by the local public health leadership. My discussion with Jay revealed the tightrope many people walked between messaging around personal responsibility, wanting limited government in their lives, and wanting the pandemic to end. Jay said, "I'm stuck between a rock and a hard place." He took a deep breath. "I'm trying to find the right words to use here. It's just not like," and he paused again. "But if this virus was so horrible and so deadly, why do I have to be tested to know that I have it? If it's really that bad?" So those thoughts run through my head, and then 10 minutes later, I'm getting out of my vehicle to walk into Walmart, and I'll put my mask on. Then again, I just don't know. I looked at him and asked, "So you feel like if it's really that bad, why should we even need tests? Because you would know that you have it." "Right," Jay replied. "And then again, I know that it can lay dormant in my system and you're carrying it and you have absolutely zero effects from it, but then it could kill my grandma in just a few days." Nodding, I said, "Well, exactly." Jay continued, you get information like this and you're going back and forth. It's just really hard. And I think a lot of the reason it's hard for me is because of the political differences. Can you really trust anyone in our government to tell us the truth? So I just go by the hospital guidelines. "Yeah," I said. I can't remember that guy from Lakes Regional Hospital. He's on there all the time. That one who looks like Lin-Manuel Miranda? Have you seen that? I burst out laughing. "Yeah, he's my brother-in-law." Well, he looks just like Lin-Manuel Miranda. And I swear to God, one of these days, I'll be watching one of those videos on Facebook and he is going to break out and start singing Hamilton. Still giggling, I said, "Oh my God, can I please tell him that? He would love it." "Yes, absolutely." Jay laughed right through his belly. I love that because one reason I got involved in doing is because I do public health stuff, and he's been working so hard on this, and I've been trying to help out, but I don't know if there's an easy solution. It just feels like the stuff you're saying is dependent on a policy directive from the governor. "Right," said Jay, and then I was listening to our governor speak the other day at her press conference, and while watching her Facebook videos, I would read the comments. They were people begging for a shutdown, and then the next comment would be someone like, "Don't you dare shut us down. We'll be just fine," whatever. And it's like, he paused again. They're just so far apart, I voted for you and I guarantee I'll vote you out because you won't shut down our state. And then the other people are like, I didn't vote for you and now I'm going to because you shut down our state, or because you didn't shut down our state. And it feels so divided, I said, like there's no middle ground. But Jay disagreed. There absolutely is middle ground, but there's just no way in our opinion for it to be reached because people have put up such big walls that there's no way to even hear the other side. Now, in some ways, Jay speaks to the partisan politics that contribute to in-group and out-groups that deepened in Okoboji and around the nation throughout the pandemic period. Social psychologist Jonathan Haidt argues in The Righteous Mind that there are 6 moral values that drive political divisions, and these values emerge across contexts: care versus harm, fairness versus cheating, loyalty and betrayal, authority and subversion, sanctity, degradation, and liberty versus oppression. Haidt argues political parties and interest groups strive to make their concerns become triggers of your moral modules. To get your vote, your money, your time, they must activate at least one of these moral foundations. A good example of getting your vote through a moral value is promoting the idea of caring. Now, caring is both innate and learned, and this is exemplified by caring for our young. Caring diverges somewhat when we move between political parties, sports teams, universities, and rock bands that maintain similar characteristics. So Haidt says bumper stickers are the clearest in-group badges. Haidt provides 2 examples. One is a liberal Save Darfur sticker that begs the reader to protect innocent victims. The conservative Wounded Warrior sticker emphasizes those who have sacrificed for the group. Now, the loyalty construct was tested during the coronavirus crisis of 2020. I found that the idea of loyalty to the president became imbued in the mass debate. This can be understood by people not wanting outsiders, that is liberals, to tell them what to do. In some ways, scientists were associated with liberals during the coronavirus response and therefore refuted by the right. The need to form groups is inherent in human history, where we have for centuries built cohesive coalitions to create a society we imagine. Now, this loyalty construct is exemplified by the strong alliances among those in Spirit Lake, Okoboji, and Harris Lake Park school districts in the Iowa Great Lakes, who are particularly loyal to their local sports teams, the Indians, the Pioneers, and the Wolves. For decades, some people have suggested that the 3 school districts merged to build a larger high school that could garner more courses, funding, and opportunities for student scholarships and extracurriculars. But many people fear such a convergence of groups will overshadow their existing identities. People's loyalties are to what they know are intergenerational, social, and fierce. These group factions were solidified further during the 2020 election cycle, which mirrored public health recommendations like masking. When you wore a mask, you were going against the group. And in many ways, people promoted in-group fidelity, that is unmasking, through shame. In Okoboji, people wanted the freedom to unmask, while often wielding shame when anyone did the opposite of what they believed. But shame works in both directions. In other parts of the country, people use shame to ensure that their neighbors would mask. Now, shame is a powerful social tool. As a feeling of humiliation or distress caused by a perception of foolishness or wrongdoing, shame shapes how people think about engaging with others. Shaming is not always visible, but masks are. People wielded shame about masking and unmasking throughout the summer around the country, causing the choices people make about whether or not to put on masks when they leave their home to be calculated, and in many cases linked to fear that they may be judged. Shaming can also be subtler. It can be a tilt of a head, scooting away of a chair, a laugh, or a stern look of disappointment. I've argued with Adam Kuhn and others in social science and medicine that ideas of shame and masking played out in distinctly different ways in Okoboji during the summer of 2020. We found that the ways in which people perceived the world around them motivated very different beliefs around COVID. And as a result, divergent actions around masking, social distancing, and quarantine. In many ways, these different ways of thinking about the virus revealed deeply embedded cultural values and sociopolitical pressures around why and how they should engage with public health. Here you can see I have the concern frame, which was the most common recorded in our data set, where people shared concern about COVID-19 and embodied the conservative personal responsibility non-policy. We found a crisis frame to be the least common, where people would do anything to protect others, even unknown people, which somewhat resembles what Haidt argued about liberal beliefs and the Saved Our Four bumper sticker. In many ways, seeing COVID as a crisis was rejecting the insularity of the community and thinking about COVID as a global concern, something very foreign to the majority of residents. Many people also embodied the constraint frame, where they were willing to adapt their behaviors in order to protect their financial or social interests. This was not only embodied by businesses throughout the pandemic, but also by school children throughout the school year. Finally, we had the conspiracy frame that reflected conservative talking points most closely. It was a common frame in the study, but I have to project that it was the dominant frame around the community. As I mentioned, Trump supporters were reticent to speak with me, and 2 in 3 residents voted for President Trump in the 2020 election. And the conspiracy frame in many ways promoted this in-group celerity by unmasking. Let me take a minute to read an excerpt from Unmasked about a space in which these performative politics took center stage. The most contested space in town, where maskers and unmaskers walked shoulder to shoulder, was Walmart. Walmart was the only place where people said they would mask, and Walmart was the only place where there was a national policy mandating that people must mask. I found people around town grappled with Walmart after the corporation instated a mask mandate in mid-July. For instance, Jay always put on a mask at Walmart. In contrast, a local politician I interviewed told me he decisively avoided Walmart because he, as part of the GOP, would not be seen wearing a mask. Walmart in Spirit Lake has become a local cornerstone, not just of consumerism, but also of security. In many rural towns around the United States over the past several decades, the arrival of Walmart led to the shuttering of small businesses as it filled their market space with products and convenience. In high school, I mentioned at a classmate's house how Walmart was ruining the town and exploiting workers. My classmate's mom sat down next to me and carefully explained how crucial Walmart was because so many people had lost their farms. When we started school in the 80s, 30% of my classmates lived on farms. 15 years later, less than 5% of my classmates worked on farms. Watching the farming culture collapse around us had a huge impact on our generation, and my sister's actually devoted her life to sustainable and organic agriculture. But Walmart also offered a secure job with health insurance linked to a national corporation for many families who left farming. It was accessible, reliable, and cheap for customers, as well as employees. You could pick up groceries and a new air conditioner in 20 minutes on your way home from a long shift. Everyone mentioned Walmart in my interviews. It was a place where some people refused to go on policy or where everyone would slip into on necessity. I remember in midsummer, I took my eldest daughter and my nephew to Walmart to spend some money they'd earned from a socially distanced, coronavirus-safe lemonade stand. My eldest daughter bought a kid's sewing machine and my nephew bought a Nerf blaster. Walking through the store, we ran into people double masked with gloves and worried looks. The next beat, we saw a man wearing a red flagship Make America Great Again hat with a mask around his chin. What was striking about the anti-masking stance was that so many people upheld a concurrent belief that if you were vulnerable, you should stay home. Many people balanced worry about someone they loved being infected and the perceived harm of masking. For instance, one woman I interviewed had a child with respiratory conditions, so she was concerned both with what might happen to her child if she developed COVID-19 and the conspiracy theory around carbon dioxide harming her daughter's lungs from wearing a mask all day. Even though the conspiracy theory was widely debunked, it continued to prevail. Now, in many ways, massive fights around masking in Iowa and elsewhere have become preludes to fights over vaccines. Among white families in particular, vaccine refusal is a weapon wielded to control social networks and build solidarity, respect, or a following. The social power of vaccine refusal is well documented. Anthropologist E.J. Sobo found many parents at a California Waldorf school use vaccine refusal to help build relationships and community. American sociologist Rebecca Reich has written that mothers who refuse some or all vaccines access social capital as they gain informational, emotional, and appraisal support from networks for their position and in opposition to those who disapprove. She describes how many mothers asserted their individual power over their children's bodies simply to navigate feelings of powerlessness in aspects of their own lives. Vaccine hesitancy in Okoboji is no different. The movement is driven by an alternative wellness community that is also deeply religious. Most of the people in the community are conservative and Christian, entwining their fervor for President Trump with their Christian faith and beliefs about the coronavirus. Now, my understanding deepened when I spoke to a woman I call Maureen, who called herself outright anti-vax. She wasn't always extreme in her views on vaccines, but cemented her beliefs after completing a yoga training with a well-known anti-vaxxer who used her studio and church to evangelize about vaccines. Maureen was recruited into the community of yogis through her vaccine refusal and spent many months doing her own research into how and why vaccines might cause harm instead of promote health. Many parents who actively refuse vaccines in Okoboji use their vaccine refusal in crucially generative ways to garner legitimacy among their friends and religious communities. In Maureen's case, her yoga teaching instructor indoctrinated her into this community and bolstered her own legitimacy through this teaching and shared community beliefs. Now, it's important to note that some mask and vaccine refusal was provoked by healthcare workers. In Okoboji, one family physician became an outspoken opponent of masking, quarantine, and vaccinations. He eventually left medical practice, but I heard people around town dismiss public health recommendations while citing his critiques. Based on my own research in my hometown, I do not believe that many children in Okoboji and similar communities all over the United States will ever be vaccinated against COVID-19 if we leave it up to personal choice. This is why I argued in Scientific American that to protect the most vulnerable children, and particularly those who cannot get vaccinated, we must close the gap of vaccine refusals with vaccine mandates for public schools. Now, strong leadership at the national level matters to enforce public health. Without compassionate and clear leadership, misunderstanding, rumor, and mistrust builds and has fueled across the nation. And this was just so clear in Okoboji. I spoke to a childhood friend in July of 2020 who was up in arms with Fauci. Fauci had just gone on national television to encourage everyone to mask. But it wasn't about Fauci encouraging people to mask that upset him. My friend wore masks all the time. He was enraged because in the spring, Dr. Fauci had urged people to stop buying masks because of a limited supply for healthcare workers. My friend was a glassmaker, but his wife worked in a hospital. Yet behind the scenes, personal protective equipment, or PPE, was in short supply across the nation, in part because of Trump shutting down the pandemic preparedness program in 2018. This program fostered the strategic national stockpile of PPE. In many ways, my friend's struggles stem from these structural problems that impeded access to PPE his wife required to do her job. Desperate to protect her, he drove to every Menards, a regional home improvement store in the area, to purchase masks. He cleared out shelves and packed them in the back of his truck. Now, I'd like to end my argument, as we see here throughout these examples, is actually inherently a logic of care. I argue that a logic of care emerged amidst the confusing debates in the media and national, state, and local leadership around COVID-19. When people had limited guidance to base their public health behaviors, they negotiated these decisions through the cultural construction of culture, politics, and identity and health. However, in doing so, many made strategic decisions about their personal situations. And this was evidenced by the mother who decided not to mask her children or go out in public because she was fearing shame, but also fearing the health of her child. On the other hand, she did not support masking for political reasons and was concerned about this conspiracy theory that CO2 may harm her daughter's lungs from wearing a mask all day. And these logics of care played out throughout the summer. In this way, she kept her daughter home, although avoided leaving her house because she would not mask. A 40-year-old man told me that he went out to the bars to get COVID to build his immunity. His entire family was infected, and they posted how they quarantined together for COVID-19 all over Facebook, demonstrating public health compliance while supporting their ideals that more people in the community should get infected. Only when an elderly family member got sick did he tell me he wished he might have thought about that decision more. This individual and many others explained their lack of fear for coronavirus by saying, "I don't fear the virus because I believe in God." Yet others rejected public health recommendations because of political beliefs as opposed to religious ones. Many told me that they thought government overreach was out of hand and embodied a theory of building immunity by leaving these masks at home. In fact, some people emphasize that they'd like to infect others to build immunity across the community, but these beliefs were a small minority. Most people took great concern to prevent COVID transmission in 2020, especially among loved ones and the most vulnerable in their lives. Now, the COVID pandemic is not over, and writing a book about a pandemic in the middle of a pandemic seems ridiculous. But there is something to learn about these first days when people resisted even the belief that the pandemic was real. In Okoboji, while the afflictions circumnavigated the globe, America's use of personal responsibility as a national or state strategy amidst the first year of the pandemic was a complete failure. This was not because people failed to care for each other. In many situations, people took great care to protect those most vulnerable in their lives. But this strategy extended to businesses and conflated local businesses with people, as Americans are prone to do. When businesses were not mandated to follow public health guidelines, many put profit over people. They undermined the efforts of local public health departments, exemplifying how an uncoordinated response breaks down and destabilizes the arduous work of public health, documenting the breakdown of the American response and how different it was compared to the rest of the world matters. In public health and medicine, it is important to write about what did not work as much as it is important to write about what did. What I hope this book does is start a conversation. Chipping away at our divisions starts at home as we think about who we are, how we support each other, and what 2022 and 23 and beyond should and can become. Thank you.